I'm Dr. Matthew Schulman, a board-certified plastic surgeon here in New York City, and maybe you're thinking about having plastic or cosmetic surgery. Hopefully this video will give you some tips about how to choose your plastic surgeon. Obviously, I hope that surgeon's me, but even if it's not me, these are some tips that will keep you out of trouble and help reduce your risk of having a complication or having a bad result and just make your experience happier. So the first thing you should do is make sure that your plastic surgeon is board certified by the American Board of Plastic Surgery. The American Board of Plastic Surgery is an organization that certifies plastic surgeons. In order to become certified in plastic surgery, there's a lot of requirements. You need to have completed an accredited residency or training program. You need to keep up with CME or continuing medical education just to demonstrate that you are keeping up with modern techniques and data and information. You need to pass both a written and oral examination to make sure you basically know what you're doing. And then you also have to submit a list of cases that you did, and those are reviewed by reviewers to make sure that you did the appropriate thing during those surgical cases. So being board certified by the American Board of Plastic Surgery just helps ensure that you've had the most extensive education and training to make you the best plastic surgeon you can be. And number two, you want to make sure that your plastic surgeon is an expert at the specific procedure you want to have done. So think about it. As a plastic surgeon, I was trained all the way from my head to my toes. During our training, we do everything from facial surgery, burn reconstruction, cancer reconstruction, hand surgery, cosmetic, skincare, everything. You'd be really surprised how extensive and diverse the training to become a plastic surgeon is. If you're looking to have breast surgery, for example, you want to make sure that you get the best plastic surgeon for breast surgery. You wouldn't want to go to someone who's an expert at hand surgery or tummy tucks for your breast surgery. And the same thing goes for any procedure. So you want to make sure that whatever you want done, that surgeon is an expert and that's what they do. Me, for example, I specifically specialize in body work. So I kind of work between the neck and the knees. So I do a lot of breast surgery, liposuction, tummy tucks, butts, mommy makeovers. But there are things that I just don't do. I don't do nose jobs. Maybe in the future, I will, and that may be something I start doing in my practice, but as of the moment of filming this video right now, you're not coming to me for a nose job. And I'll be the first one to tell you, here's a name of somebody that's a true expert in nose jobs or rhinoplasty, but I'm not your guy. The third thing is you want to make sure that your plastic surgeon is on staff at a reputable local hospital. I'm on staff at Mount Sinai Hospital in New York City. So what that means is that I have access to that hospital if I need it. Now I do all my surgeries here in my operating room. Those that follow me probably know that I have an accredited certified office operating room. So I do my surgeries here. But in the event, the rare event of a complication or an emergency, I can go a few blocks away to Mount Sinai Hospital where I have access to a hospital and other doctors and emergency equipment and whatever I might need in the rare event of a serious complication. You want to make sure that your surgeon has privileges at a local nearby hospital, and that will help keep you safe in the rare event that something bad were to happen. The fourth thing is sort of related to being on staff at a local hospital is it's best to find a plastic surgeon that has an academic appointment at a hospital. So I happen to be an assistant professor of plastic surgery at Mount Sinai Hospital. That means that I work with medical students and residents and other doctors, and I have access to conferences and different seminars and programs that are associated with a large academic teaching center. Now, I'm not saying that that makes me a better surgeon than somebody else, but it just gives me more resources at my disposal. So it's just a lot easier for me to get continuing medical education or be able to reach out to colleagues if there's questions about something, or I just need, an extra brain to figure out what's the best thing for you as my patient. So having an academic title at a large teaching hospital has its advantages. The fifth thing that you should keep in mind when choosing a plastic surgeon is, what are their results like? It seems obvious that you want to pick a doctor who has great results, but you want to make sure that you see those results. In today's day, it's easy to see results. People post before and after pictures on their website, on social media. Sometimes in the offices, they have books that you can flip through with before and after pictures. So it should be easy for you to see results. You want to make sure those results are long-term. That means you want to see what that person looks like at least a year after their surgery. You probably know that it takes at least a year to see your final results. So it doesn't matter how good the person looks a month or 2 months after surgery. That doesn't tell you what they're going to look like a year or 2 or 3 after surgery. So you want to make sure that the before and after pictures that you're looking at, whether it be in the office, on the website, on social media, are long-term, at least a year after surgery. Now, if you're looking for before and after pictures and maybe you just don't see a lot, there's not much on the website, there's not much on social media, the doctor doesn't have a book or something for you to look at in the office, that's a little bit of a red flag. That may tell you that maybe the doctor hasn't done as many of the surgeries as he or she is making you think they do. Now, in all fairness, there are certain procedures like face procedures that are a little bit more difficult to post before and after pictures online or on social media. That's because we try to keep our patients confidential. And it's easy for me doing body work to show someone's breasts or belly or butt and nobody knows who they are. In fact, a lot of my patients, when they see their own pictures, and they've authorized me to post their pictures, so nothing's being done secretly, but when they see their own pictures, sometimes they don't even recognize themselves because it's just from here to here, and they're all wearing the same underwear or bra or clothing to keep the picture standardized. So it's very easy when you're dealing with body work to keep people anonymous. But if you're doing face work, it's much harder. What if you're trying to show the results of eyelid surgery? You can't block out someone's eyes because then you can't see the eyelid results. So I get that there are certain people who specialize in face surgery where it might be a little bit more difficult for them to post pictures online. But those are the people that probably have a book in the office. But the point is you want to see a lot of long-term before and after pictures of the surgery that you're interested in. I hope this helps you a little bit in your search for a plastic surgeon. So remember those 5 tips. If you like this video, make sure to like, comment, and share. Check out the other videos on my YouTube channel, and hopefully I'll see you soon.